Christoph,
So
you
it's,
can put the
it's
music.
6:30. Yeah.
Let's just give it a few minutes and so more people can join.
Yeah, I don't think Dr. Aurora got the link, so I'm just sending it.
हम थोड़ा साथ में नोट्स निकाल रहे थे तो मैं नीचे जा रही हूँ मैं नोट्स निकालने को तो विल बी ओके ना हाँ नहीं दे एटलीस्ट रूम पर ठंडी रहेगी ओवन में
Dear friends, while you are entering, please mute yourself.
Yes, so let's get started. Hello, everyone. It's probably 6:33 in India and in New Delhi. So can you hear me?
Yes, excuse me, I would like to mention that the meeting will be recorded. Thank you.
Yes, so let's get started. Hello, everyone. It's probably 6:33 in India and in New Delhi. So can you hear me?
Yes, excuse me, I would like.
Okay, great. So I know there's some people that are still in the waiting room. We're going to let people in. Welcome, everybody. Thank you so much. You've joined the webinar on reporting on children's schools in the pandemic, which is hosted by the Internews Health Journalism Network. And it's also with the support of Unicef India. We have some great speakers today. And I just want to say a few words about the Health Journalism Network of Internews, which really was started about a year ago, just about a year ago, October 2020, at the height of the first and second wave of the pandemic. And we brought together a lot of reporters that cover health all the time, but also reporters that found themselves covering health because of the global pandemic. And this is a community of media professionals that from 85 countries, over 1,030 reporters and media professionals. We also have some tech people and we have investigative reporters. We have health communicators, and it's a community that seeks to mainstream health in news and also to equip media professionals with the tools they need to do the job well and to do it to elevate the voices of also populations that are marginalized from mainstream media. So without further ado, I'm going to pass the word to my colleague, Dr. Jaya, who will moderate this webinar today. Thank you.
Thank you so much, Bea, and welcome to every one of you who've joined us on this interesting webinar, which is very much in the air at the moment, this issue of schools reopening safely. It's not just an issue in India, it's an issue all over the world. And we're awash with media reports that talk of an imminent third wave, that children may be disproportionately infected, and that schools may not really, it's not really a good idea to open schools at this point, or if it were a good idea to open schools safely, how does one go about it? So to discuss these and other issues, we're going to try and set the stage a little bit before we start. And to do that, I really think we need to steer this conversation in a new direction, and that is a more solutions-oriented kind of thinking, and sort of lift it out of the shallow waters of the current debate. So we're going to look at a few things that we already have on hand. One is the Unicef developed framework on reopening schools safely, which is available, which is a generic framework, which is giving instructions about how to go about opening schools safely all over again. And you have these state operating procedures, the standard operating procedures that some states in India, for instance, have issued that are supposed to offer some guidance to schools that want to open up. But these are generic frameworks and they are high-level guidelines. And there's very much a lot of confusion that's out there about how would, say, a suburban school or a local school in a rural setting really find a way to apply these guidelines and go about undertaking certain ways of acting or working with the principal actors at the field level to go about and open the school safely. So what we would like to explore through this webinar are two key things. One is, should we be looking at a global toolbox that might offer some very specific, a specific set of algorithms, operational algorithms that schools could sort of follow, that could be applicable across a variety of settings, that could be adapted to a variety of settings. A toolbox that could talk to some principal actors, such as the school management, teachers, parents, children, and also journalists, where you would go to this place and open it up and find something in there that's just for you, a set of menu-driven options that you could apply for your school, for your setting in your community. And would it be possible to sort of connect that toolbox, the way to use that toolbox with the prevailing condition of the pandemic at that time? What would a school management professional do, for instance, if there was a new variant of concern or a variant of interest that the WHO suddenly flagged up? Would you stop opening the school at that point? Or how would this toolbox integrate with a larger epidemic alert system? And that's something that we're going to be able to discuss today. We have Dr. Prabdeep Kaur from the National Institute of Epidemiology, Government of India. She's the Deputy Director there and a member of Tamil Nadu's Special Task Force on COVID-19. We are also joined by Dr. N.K. Arora, who's the Chairperson of the National Technical Advisory Group on Immunization for the Government of India. And we have a pre-recorded interview with Mr. Terry Durnian, who's the Chief of Education in UNICEF India, who has given his remarks in advance, and we'll be playing some of those out in the course of this webinar. But before we sort of dive in and look at really risk assessment and try to sort of find out how we go about making decisions to open schools and in what way we should do that, I'm going to ask my colleague Bea to talk about the poll that we did, which we sort of sent out to the public, and let's have a look at some of those responses. So back to you, Bea.
Thank you, Jaya. So I am not going to share the screen, but I'm going to read out the questions that we put out on Twitter and on Instagram. UNICEF, through their Instagram account, they have many followers. We put out, the first question was, how concerned are you about sending your child to school? And the answers we got are 33% very concerned, and 33% not concerned at all. So somewhat of an even split. And this was done globally, not just India. So we had people answering from different parts of the world. The second question that we sent out to get a feeling and a pulse from how people are thinking is, how satisfied were you with the quality of virtual classes during the lockdown? And we got, probably somewhat predictably, higher than 70% very dissatisfied, and about 22% somewhat satisfied. Then the third question we sent out, both on Instagram and on Twitter, was, do you think that a mix of in-person and virtual teaching is the best option we have to keep children safe? So over 60% said no, and about 35% said yes to a hybrid hybrid teaching methodology. So these are really interesting, to get a sense of what people are thinking. For those of us who are parents, we may resonate with some of these answers. And Jaya, I let you kind of also share your thoughts about these.
But the interesting thing there about the poll results is about the ambiguity. They're typical of the ambiguity that's out there. There is a lot of confusion. I mean, we may have frameworks and we may have these standard operating procedures and a lot of very helpful advice from a range of experts. But when it comes down to what a parent or a teacher or a school administrator reads in the media about the Delta variant, for instance, and the threat that it poses to children's health, when we read reports of a teacher in the United States infecting a whole class, she had no idea she was infected and she was not vaccinated. Well, that really sets us thinking about what to do. So, which is why we would really like to drive the conversation in this webinar towards some concrete sort of outcomes about whether we can have a set of clear operational steps that schools can follow at different levels. If it's a rural school, if it's a suburban school, if it's a primary school, if it's a middle level school, how do you work with specific solutions, and can we develop a toolbox of that sort that will work closely? The education and the health departments working closely together to tell each other, to alert each other of an imminent new strain on the horizon. So we're calling for greater conversations seamless real-time conversations between the health ministry and the education ministry across the world. So is there a way to do that? Like getting a weather alert that there's a cyclone building up in the Bay of Bengal, for instance, and it's time you should think about keeping your schools partially closed because there's a new variant on the horizon. So is there a way that we can do this? So we really want to make this a solutions-oriented conversation. We know there's a situation. We know there's a lot of confusion. So I'm going to first turn to Dr. Pradeep Kaur to sort of get us thinking more clearly about how does the National Institute of Epidemiology, for instance, go about assessing the risks? At what level do you do it? And how does one really think of, if I wanted to know whether my neighborhood has a problem and whether I can open my school or not, or whether I should be sending my child to school, how do you really assess the risk at the local or the community level as well? So Dr. Pradeep Kaur, over to you.
Thank you very much, Dr. Jaya. Thanks for the opportunity. I request the host to enable me to share my screen because I just want to show 1 or 2 slides to just make it easier. Yeah, thank you. I think, yeah. Yeah, so I think the question that we are asking today is a question very close to our hearts. Most of us are parents as well. And also we are involved in day-to-day making decisions about whether children can go to school or not in various roles. And it has become an ethical dilemma because we know that there are several factors which are in favor of opening schools. We know that it will improve children's well-being. It will mitigate the learning loss. There's a lot of data which shows there is a lot of learning loss. It will definitely help even the nutrition of children who have been part of the midday meal programs and several other feeding programs in various parts of the world. And of course, there are children who have to go to work because schools are not open. And it's really a major loss in their overall development. But we do realize that there is also anxiety among parents, and I'm a parent as well. I have a 15-year-old. So I completely understand that it's natural that it's not easy for us to send our kids to school because we have poor vaccination rates and there are a lot of other technical challenges. And we know the risk to parents, teachers, and elderly if they are in the house. So I just want to put things in context that schools are also part of the community. We must understand that they are one setting. We have multiple settings, and we've been talking about risk in congregation, risk in workplaces, risk in markets, and schools are another setting. So some of the principles that we apply are quite classic principles. And I have just shared a picture here of a possible, what we call as an alert system. So if we do have a system in place which tells us what is the level of risk in a particular community, it helps us make decisions about opening. And the opening could also be in a phased manner, as you can see here. This is just an example, and you can have many types of alert system and can be adapted to local setting. But most of these alert systems look at very simple data, such as case numbers, incident, that for given population, how many cases you have, what is the test positivity of all the tests which are done, how many are turning positive, and also the bed occupancy, which tells us whether hospitals are getting flooded. So this kind of simple system, which can tell us what is the level of transmission in the community? Are there active clusters? Are we seeing any major outbreaks? Is there a change in the pattern of the type of cases which we are seeing in the hospitals? So if we are watching all of this, it helps us in making much more informed decisions in terms of what we can open and what we cannot open. It also helps us in deciding when to close. So keeping this in mind, all I would like to say is that the schools are no different. Schools also come into this whole gamut of decision making about what to open, when to open. And some of the very simplified way, I just wanted to put it here because I know it's a diverse audience. So first of all, we can open when there is no widespread community transmission, as indicated by all these various epidemiological indicators. When we know that there are very low number of infections being reported, when we know that of the test we are doing, less than 5% are turning positive, and ideally even less than 1%. And more importantly, many of these indicators are often assessed at a level such as district, but we also need to pay attention to local clusters. Sometimes it may happen that in a big city like Chennai is a metropolitan city, overall the city may have very good indicators, but there may be a small cluster in a particular community. And therefore that may influence our decision to keep the school open or not. So paying attention to local clusters is extremely important in addition to all these indicators. So I think this is a broad framework we can use, and we'll discuss it further as we go along. Thank you.
Thank you, Dr. Kaur. I think this is terrific because what you've laid out is some kind of a formula or an approach or a set of steps through which people can make decisions. My question is, how much of this kind of information is really filtering out to the public? I mean, it's all there, in the heads of the scientists and the researchers. It's sitting inside the National Institute of Epidemiology, but we don't have access to it. So is there a way that we can sort of bridge that?
Absolutely. I completely agree with you. This information should be out in the open. As you are aware that the governments do put out what is called as media bulletins. Most Indian states and also at the national level, these bulletins are put out. But I think what is important is converting these numbers into information and using them for decision making. And we do see there is a gap there. And of course, we work closely with the governments and we help them in converting this data to information. But ideally, we should have more of what I would say as dashboards, which are open to the public, which should be displaying this information definitely up to a district level, but which should also be displaying some information which is more local, mentioning if there are new clusters emerging in a particular part of the city or a village, and mentioning if there have been any congregations which led to any particular outbreak specific to an area. And having all this information in the public will make everyone feel a lot more comfortable, knowing that, okay, their kids can go to school and there is no risk. So I completely agree with you that the information should be out there in the public, and scientific community like us, we are very open to working with any organizations which are willing to use this data and put it out there. Thank you.
That's wonderful. Thank you, Dr. Kaur. I'm already seeing in my head a kind of a dashboard that the public can actually use There are a number of dashboards that carry COVID numbers, but we just see them, and it's a shock and awe kind of a reaction that we get. There's very little data that we can actually use to think about what we should do with schools. So that's really interesting, and we're going to come back to Dr. Kaur with more questions about risk assessment and safety precautions in the school setting. But before that, let's listen to Mr. Terry Durnian, the education chief of Unicef India, who spoke with us earlier, who sort of gave a little bit of a global snapshot about what is it that's happening to children because of being away from school for more than a year and a half. And I'm going to request my colleague, Michael Salzwiedel, to sort of play that video for us, and we'll get a chance to listen to Terry. Michael?
Thank you very much, Jaya. Just getting the video up on the screen for us. Let's go. So let me know if this is showing.
Yes. Yeah. We just need to get that first video playing.
Sorry, Jaya, is it not playing?
No, it's not.
Oh, that's not good. Sorry, let me just try again. Wrong window. Oops. For some reason, I don't have the option to share that current screen. Christoph, if you got these on backup, thank you very much, Christoph.
So hold on for a minute, folks, till the video comes on. But essentially, UNICEF has been doing the painstaking job of sort of trying to do these large-scale studies across countries, trying to look at what the...
I think when we talk about the global level, children are being affected the exact same way they're being affected in India, to be honest. We looked at 90% of the world's student population have been out of school because of school closure. And that has a devastating effect on children and their futures. Firstly, there's millions of children missing out on education. School meals discontinued, so they're going hungry. Increasingly, children are vulnerable to early marriage, child labor, and violence. So this is really impacting on children's welfare in life. We're looking at 7.6 million girls from pre-primary to secondary at risk of not returning. Secondly, learning loss. We know already before the pandemic that learning was in crisis, but it's gone from crisis to catastrophe. Rote learning was able to mitigate some losses, but it's not really successful in the long term. Children really need to be in school to really affect and change the trend of learning loss. And then there's the area around inequality. We know that it's expanded globally. Between the privileged and those left behind, the gap is widened. And with countries with huge inequalities with children facing multiple forms of marginalization, they're falling farther and farther behind.
So children falling further and further
behind.
When
we talk about the global level, children are being affected the exact same way they're being affected in India, to be honest.
Christoph?
We looked at 90% of the world's student population have been out of school.
Yeah. Thank you so much, Christoph, for playing that. And before we continue, let me ask you all to join me in extending a very warm welcome to Dr. N.K. Arora, Chairman of the National Technical Advisory Group on Immunization for the Government of India, who's taken time out of his busy schedule to join us. Welcome, Dr. Arora. So glad you're here with us. So we had a chance to listen to Mr. Terry Durnian, who sort of spelt out what might be the spectrum of adverse sort of impacts on children who've been away from their peers, away from learning and learning from each other and learning in person in the school setting. But and one of the major ways in which governments all over the world are trying to sort of address this is, of course, preventing COVID transmission, and that too with the help of vaccination programs. And so I'm going to turn now to Dr. Arora to sort of try and tell us how the vaccination intervention as part of our whole spectrum of protections that we have to prevent the transmission of COVID, how do you think vaccination is going to play out as a program, specifically keeping the safety of the schools in mind, how to get children safely back to school? Over to you, Dr. Arora.
Thank you very much, Jaya. I am honored to be part of this distinguished panel. So I will start with some background information that in most of the high-income countries, even at the peak of pandemic, that means last year, then December 20, January, February, when there was second peak, and later on now also, the schools have never been closed, particularly the primary schools, because cognition and mental development is critical in these first 5-6 years of life. That means up to 10 years of life when the child is in primary section. And the reason is that children are actually vectors of infection. They carry the infection from their house to somebody else's house to the child, or give the infection to the teacher or to the other schoolmates and the school employees. And our own data, Indian data as well as global data, both from first cycle as well as second cycle, is very clearly mentioning that children are hardly ever affected. Most of the time, infection is asymptomatic. And this is demonstrated by that the seropositivity in children as well as in adults is very similar. That means children are as much, even though they are in quotes, protected environment of their homes, but they are still infected. That means keeping them at home is not helping them to avoid infection. But fortunately, there are biological reasons that children do not get severe disease, and death is extremely rare. And mostly these are children who have comorbidities. So when we are opening school, actually the preventive measures are more important for the ring around the child. That means the family ring as well as the school ring that needs to be protected. And how we do this? So when a country has a good immunization program or sufficient vaccines are available for families of children and the school, then the schools can be open, even when the intensity of circulation is high. The reason is child herself or himself is not affected, but they infect there. So there are incidences, there are reports when teachers have died, or elderly parents, grandparents, and others in the family have died because the infection was brought. So the point I want to make here is that now when we have a rapid and excellent immunization program going on, almost 70% of adult population, that means 18 years and above, we have around 90 to 94 crores. They have got at least one dose. Plus, families also fall in that. Elderly were prioritized, and more than 70% of the elderly have got vaccine doses. And recently, government released an special 2 crore dosages for school teachers and school employees. So primary objective is that we should have a protective ring around child. Child is fine, even if I do not immunize. Ultimately, we will immunize the child. But at the moment, it is the adults who have to be protected through immunization. And also, we have another advantage. And I would like to assure our parents here that in India, 70 to 80% of common man is infected today. Now, this is a blessing in disguise that 70 to 80% are naturally infected. On top of that, we have immunization program. Now, that becomes a very solid kind of a protective ring for every individual, and therefore the school opening should not be delayed anymore. However, I totally agree with Pravdeep Kaur that if there is intense transmission of virus in the community or in your immediate adjoining, the risk is to adults, not to the child so much. So I was making an algorithm after having discussion with you in the morning. And so test positivity rate means if I do 100 RT-PCR tests, if less than 5 are positive, it means virus transmission is not too much. But I would rather have less than 1%. So if my positivity rate is less than 1%, I can be reasonably comfortable that not much transmission is taking place. And therefore, adults are not at risk. The second is that when schools are open, there are standard guidelines. I will not go into detail, but for the benefit in a very practical sense, when a child is noted to be sick, either fever or nasal drop or coughing, I have to take 2 or 3 actions. One is isolate that child and try to find out whether in child's family somebody is having COVID, because it means the child is a carrier and then it will follow to the other children in that school. And so child is not at risk, but it is the other. So I need to protect the elders in the. But on the other hand, if an elder, the teacher or a employee or a driver is sick, immediate testing must be done in that particular individual, because if he has or she has COVID, then she needs to be taken care of properly as per the protocol. So what I'm trying to say is schools can be opened without any fear now when we have a good immunization program, but we follow all the protocols which are laid out, and I don't need to go into that. But if a child is sick, I need to isolate and find out definitely from the family of that child. If an adult is sick, get complete investigation of that child for COVID, because there is a possibility this person may have picked up infection from somewhere. The second dimension is about which Pradeep has very nicely has kind of enunciated, that opening school is not opening the doors of a closed building. It is mainstreaming the child who has been away from the school. It was mentioned they have seen family, domestic violence, they have seen deaths, they have seen loss of wages, etc., etc. So there is tremendous mental stress on one side. The second is urban-rural. Now, I'm sure many of us who are in Delhi, we know that children are going to government schools, but private schools are not opening because parents are not sending it. Now, this is that unfounded fear in so-called upper class that my child will be better protected, which is a false, which is a myth. Because child is all, most of the children are positive just like adults. So school is so important for their cognitive development, for their mental development, for their physical development, that schools must be open for these children. And it is a collective responsibility. So education department, the health department, I added women and child department should also be coming up, because they provide psychological support. A lot of psychological counseling is required for our children, because the home they have been there for last 1.5 years, many of them have gone through different kind of trauma. And the second dimension is that because of access to technology, we may not have the same kind of exposure to whatever effort we were making to all classes. So there is that. Finally, I would conclude that we need to continue with hybrid system. That means school and distance learning or web learning has to continue. And I think it may be a great opportunity for innovation, that we go into a mode where the best of the two methods can be brought in. I will stop at that. Thank you very much.
Thank you, Dr. Arora. I'm going to quickly request Christoph to sort of queue up the second video, and then, and while that's being set up, let me continue with the discussion. Dr. Arora, you really flagged up some key issues, and one of that is this whole myth around it's very, very important to vaccinate children on a priority basis, whereas you clearly seem to suggest that it's much more important to vaccinate adults on a priority basis, and that the government of India is rolling out something special for teachers. So we're going to discuss that a little bit more, but before we continue with the conversation and take questions from all the people who've enrolled for this webinar, I think we will listen to Mr. Terry Durnian talking about what kinds of concerns are out there and what needs to be addressed.
The thing about India, schools are reopening after the second wave. We have, I think, about 26 states now have begun some form of reopening. 7 states have opened all grades, but only 1 state has opened Anawadi centers. So there's quite a diversity. But we know that the reopening of schools is good news for children and their well-being. But at the same time, it's not an easy decision for governments or decision makers. It's fraught with emotion, fear, concerns, and heated debates for and against. The concerns and questions raised by parents and community need to be addressed. And really it centers around safety. And all the states do have protocols, but it's the implementation and the consistency. So we're looking at social distancing in class, staggering attendance, 50% in the morning, 50% in the afternoon, to reduce school numbers, better ventilation, wearing masks, provision of hand washing facilities, hygiene. But it's not schools alone. You need to involve parents and communities so they're sensitized of what's happening and they feel comfortable. So they have knowledge of what's happening in school and they can reinforce that at home. But evidence continues to show that schools are not the main drivers for transmission. Children are more likely to contact the virus outside of school. And they may have mild symptoms, but the evidence shows that infected younger children are less likely to spread COVID than older children. So really the lesson here is open younger grades first, but it's also emotional. You're more protective of younger children, and I think as we discussed earlier, it's balancing the emotions and the science and finding an understanding between.
Absolutely. So it is a highly charged and emotional issue, and the science around it that swirls around us is still unclear. So I think a lot of the fear stems from the ambiguity and the confusions that we still have. So I would still strongly sort of try and drive the conversation towards some concrete solutions and outcomes, one of which is, again, harking back to the algorithms that we need, very specific user-friendly algorithms that are easy to understand, whether it's a teacher looking at them or someone who's running a small school or a parent, that will help them make a set of decisions, like in a cascade. What do I do if there's a variant on the horizon? What do I do if my child refuses to wear a mask? What do I do if the teachers are not vaccinated in the school that my child goes to? So at every point, how do you make a decision? So those algorithms would really make a difference. But I think we're all set now to take questions, because that's what this webinar is for. It's to make sure that we are able to provide an opportunity, a sort of a bridge to two wonderful experts that we have here. And I must mention here that Dr. Arora is also a pediatrician. So that's why a lot of what he said has come from decades of experience. So I think the floor is now open for questions. I'm going to turn it over to Bea now.
Thank you so much, Jaya. It was a really fascinating discussion. I do have a question that I might just pose. What to the speakers and also to you, Jaya, what would you say has been missing in the media coverage of the schools reopening, or in different parts of the world they've already reopened? What are some angles that you don't see being covered that could be useful for journalists?
Okay, I'm going to take the privilege of going first before I turn it. I'm being really rude, but I really think that we, as I mentioned earlier, we need to lift the media reporting out of the shallow waters in which it finds itself. We do know there's a situation. We do know people are concerned. And we do know that you have to mask up, get vaccinated, promote ventilation, and promote hand washing and all the rest of it. But that doesn't seem to be nearly enough to reassure a parent or to educate a school management professional or a teacher to boldly go ahead and say, okay, I've got the guidance I need. And I think we need to have more in-depth journalism around that looks at solutions, very concrete solutions. I mean, do we as journalists know what questions to ask of policymakers exactly that might help our audiences make a decision about whether or not to send the kid to school? So I think, that's my personal sort of take on it, but I will ask Dr. Arora first, and then maybe Dr. Kaur can take that question.
Thank you, Jaya. I was noting down, I think media, headline for media is vaccine for children available. Vaccination of children going to start in October, like COVID, and all. That is the media line. Rather than saying that it is the adults, the teachers have to be immunized. I do not know, not even in a single newspaper or the channel talked about the 2 crore earmarked doses for teachers and school staff, which is more important. So I like this point that what media can play a role. Media can play the role that adult immunization is more important. So if child is coming back with running nose and fever from the school, child is at very minimal danger. It is the family members, the elders in the family who may land up in the hospital in next 5 days or so, or vice versa, teachers also. So that I think that needs to be done as headline news rather than now the co-vaccine trial for 2 to 18 years is almost complete, and we should be able to have children from December onwards. So obviously the children will be immunized, and I can assure the country has made a plan that we have 44 crore children. And 44 crore children we will be able to immunize in about 3 or 4 months. It will be taken up in a campaign mode. The issue is that immunization is going to help again the adults, not the children so much. In fact, there is a talk going about whether children should really be immunized, because there are some, at least for the vaccines which are not available here, there are some adverse events, whether child should be exposed for that. So the media has to learn a little more and how to put across a more important and emphasize a more important point. Over.
Thanks, Dr. Arora. That was really helpful. Dr. Kaur, you want to add to that?
I think mostly you and Dr. Arora have covered the issue, but I do agree with both of you. One of the problem I feel has been the connection that somehow in everybody's mind that school can only reopen if the children get vaccinated. I quite often hear this argument from parents, including parents of children in my son's own school. In one of the webinar which was done by the school last year in January, I was the only parent who said that school should open because in January transmission was very low and my son was in 10th. He was barely learning anything online. So I feel this somehow in parents' mind, as Dr. Arora said, this concept has not been clearly understood that vaccination, whom it protects and why is it so important. I think we need to make it very clear that vaccination is not a prerequisite for opening the schools. That message has not gone out. And second, I feel we haven't shared enough positive stories. We know that many states and many countries outside India have been keeping schools open. But I haven't come across enough media coverage of that, saying that these schools have been open for so long, and yet we did not see any serious infection among children, which tells us that it is okay for children to go to school, because it's very hard somehow for parents to understand that the child will not get a severe infection. They want the risk to be like zero, and somehow it's very difficult for them to feel reassured. I think it's important to share positive stories. It's important to clearly send a message across. Vaccination is not a prerequisite. And of course, we must encourage vaccination of all adults in the family, especially the elderly and comorbid and parents if they have a school-going child, but not let the child's development be sort of hurt because of this lack of vaccine for the child. In addition to that, I feel we have also not openly talked about low risk of severe infection among children. That itself has not been adequately covered by the media. So giving a more balanced perspective rather than creating a fear would give more confidence to parents. Thank you.
Thank you so much, Dr. Jaya. I have a few questions that have come in, some directly to me, some in the chat. Let me start with the first one. One question is, how do we convince school management in rural areas about reopening schools? Maybe there's a difference between urban and rural. So one question is that. The other one is, maybe I'll just put it out so you can think who can answer. Will hybrid learning lead to a holistic development of a learner? So how can hybrid learning really empower students and bring a holistic development to a student? So maybe these two, rural areas and hybrid learning. Any takers?
Let me come on rural-urban divide.
Mm-hmm.
I always, people always think that people staying in rural areas are less progressive, but it is contrary. A lot of people thought that initial immunization and COVID is just urban phenomena. If you look at the COVID dashboard, 70% of vaccines are being delivered in rural areas today. And in fact, most of the rural schools, which are government, are open today. I'm coming, day before yesterday, I came from Meghalaya. I was deep into East Khasi Hills. All schools, I took photographs, and it's so beautiful and exciting to see these children, 4 years, 5 years, going to school, carrying their bag. And so to me, it appears it is convincing the urbanites and so-called upper class, more enlightened class who are more fearful. And particularly the discussion about involvement of children during so-called third wave and other things have also, I think, adversely affected the morale of some of those who are more enlightened. So, even in, I think in Delhi, government schools are mostly open. They are functioning. It is the private school where children are not being sent.
Thank you so much. In fact, to your point, we have someone saying, very good. I run a school in rural area and parents only fear closure of school. No one is worried about the spread of corona. Here, everyone is willing to send students to school. Elderly vaccine is running very well. So to your point, what about the hybrid learning and how hybrid learning can really foster a holistic development of students? Maybe I don't know anyone that has the education background and can answer to that. The hybrid learning, it's more of an education question.
I think we are not really competent enough to answer this question. But I can say from what we have observed in the past 1 year that online learning alone has definitely not worked, especially for children from rural areas and children from lower and middle income groups. And I can very confidently say it has not worked for my son, who's a teenager. So I think it's just the online alone doesn't seem to be working.
Deep, sorry for interruption. I think it has not worked for us also. We are getting fatigued. So
Yes.
Forget about children. हमारे लिए भी परेशानी है.
Exactly. So I do miss in-person interactions as well. So I think we need to be very clear on that part. Now, of course, we know that there is in classroom learning is best. We know that. I would say that we should use hybrid learning as a backup and be ready to go into that mode. So have some systems in place that if a situation arises, as Dr. Arora pointed out, that there is a community transmission putting teachers at risk or putting community at large at risk due to a new variant or any other reason which may lead to a sudden spike in cases. And we should use hybrid learning in those situations as a backup. And we should really encourage more of classroom learning. Especially, I feel in context of India, children have been out of school for way too long. And I think it's one of the longest compared to many other countries. So hybrid learning as a second option and not as a first option. That would be more, I feel that would be better for children's future. Thank you.
Thank you. Thank you. Jaya, you go ahead. You've seen a few questions, right?
Yeah, I just wanted to read out Mrs. Vasanthi Sundarajan, who is a principal at the Padma Seshadri Balabhavan school in Chennai. And she says a cause of concern everywhere is the well-being of elderly people at home. And school-going children might pick up the infection in the school setting, carry it home, and then pose a risk for older people and more vulnerable members of the family at home. So how should we go about addressing this concern? And her second comment is about the hybrid system. Although it looks very attractive on paper, it looks like a very facile solution. There's a lot of skepticism about how to practically go about making it work, actually making it effective, right? So the two methodologies are different, and the hybrid system seems to be easier than done. So, and the third question really is, after more than 1.5 years, when children do go back to school, it will be a bit of a shock for them, a completely different experience, emotionally and psychologically. So are schools and teachers equipped to handle the emotional well-being of children, to sort of emotionally rehabilitate them in, back in the school setting? So those are really interesting questions, and thank you, Vasanthi, for those. But who would like to take those?
I think I'm happy to answer. The first part of it is about elderly. I think we do know that elderly should be vaccinated. Everybody is convinced about that. And the second most important thing is if there are any child has any symptoms and is returning from school with cough or cold or fever or anything like that, I think we need to educate parents that the child should be kept away from the elderly and tested at the earliest. And if positive, then the family could also be tested. So these are very standard precautions that we'll have to put in place in every setting. And of course, I think I can say for sure, as far as like Tamil Nadu is concerned, I've been working in COVID here. We have good testing system in place now, which is, I think, one of the sort of reassuring things. We can really get tests done any part of the state. Be it rural, be it urban. So we have to just make people aware that if the child has any symptom, you isolate them, you first quarantine them, get them tested, and then do the testing for family if required. Now, of course, as a teachers, I think they have a better idea about the second part, whether the hybrid mode is working or not. In fact, they should be telling us about this rather than we telling them. And going back to school, I don't know whether we need any specific interventions for children when they go back to school, because wherever the schools have been reopened, children have actually welcomed it and embraced it and like the idea of going back. So I don't see any challenges from children's side in going back. Thank you.
Thank you so much. I see another interesting question here that came up, Dr. Jaya and the panelists. Given that the risk is low for children, then should the vaccination, if they're available, be made mandatory for students, especially the little ones? I think this is a big question because also of the recent Pfizer sort of testing and data coming out on younger children. What do you all think about this? Should it be made mandatory for younger children, given that the risk is low?
That's an important question, Bea, because I think it's coming from someone who teaches primary school. Mrs. Teresa Sitaraman teaches primary school, so I can see why she's concerned. But yes, absolutely. Who would like to take that? Dr. Aurora, maybe? I think, yeah.
So to me, as I'm listening to the various points, I think this is another opportunity for there is something seriously a serious gap or deficiency in our immunization program, and opening school is an opportunity again there. And in elderly, there are 40% elderly who haven't got a single dose of vaccine. And out of the 60%, only about 40% have got 2 doses. So what I would say that when we are opening the school, a massive exercise is required that we tell parents, please get yourself immunized and get your elderly parents or elderly family members immunized. This is a great opportunity for that. And similarly, everybody in the school, the employees, the teachers, the drivers and attendants, they should get immunized. So what, again, which I started with, we surround the child by a ring of protected individuals rather than susceptible individuals, adults. And I think this should be, as we open school, this should become one of the major messages.
Thanks, Dr. Aurora. But there's another question from Miguel Miller. What do panelists think about prioritizing children versus, giving booster doses to the older people or those who are immunocompromised? I mean, this might be a question suited to the US.
Let me take it up. This is a contentious issue. If Israel gives booster or if USA gives booster, doesn't mean that we should be giving booster. We have a very unique situation I started with. 70 to 80% of Indians are naturally infected. And if these people get even a single dose, it's like booster. If we get 2, it is like a double barrel protection. The key is that all adults must get the vaccine booster, whatever data. In fact, Prabdeep knows that there is a national vaccine tracking platform operational at ICMR headquarters. Many of us have been involved in that. And that shows that even single dose is very effective in India. 97% protection from death, and 2 doses protect us 98%. So it's the time for booster is not there. Yes, you have raised very important point. In children also, there are 4 or 5 conditions. I will not like to spell out because they will be formally kind of made public. But these children need to be immunized because the risk of getting severe disease and death is about 7 to 8 times higher as compared to other children. So that is going to come up, and these children will be picked up very rapidly for immunization. But even otherwise, even these so-called children with comorbidities, when they get infection, the risk of severity is at least 5 times less as compared to a normal 18-year plus adult when they get the infection. So I think God is particularly kind to these young friends of ours. And so the fear should be on us rather than for child. And we should, now the immunization program is very much there. There is no shortage of vaccine. All of us should take this another opportunity to get all parents immunized and the family members.
Thanks, Dr. Aurora. I just wanted to present one more interesting question from someone, Mrs. Lakshmi Krishnakumar, who runs a school for children with special needs. And she asks, what would be some important guidelines to be followed in special schools where children have health issues like seizures or low immunity? This is a school for children with learning disabilities and autism. So how do you really work with promoting?
So just to let the kitten out, all such school children are on priority list for immunization. So as the vaccine for children becomes available, they will be immunized first. Children with any neurodevelopmental disorder is on priority.
Jai, thank you so much. I just want to note the time because we always make a promise and a commitment to stay within the hour. So it's 10:02. Maybe, is there any other pressing question, or maybe we can thank our panelists? There is some interesting commentary about the Pfizer vaccine that looks like it has been approved in the US for a smaller dose for children 5 and up. And that's of course, that's another story that journalists need to look into. I mean, Pfizer itself is sort of sharing the data and saying, let's go ahead with the vaccine for children 5 and up. But I think journalists also need to question and keep on asking questions that might seem also uncomfortable at times, but that's the role of the media too. So any thoughts, Jaya? And then I'll leave it to you to thank all our panelists.
Sure. I wondered, Bea, whether we have time to play the last clip from Mr. Terry Durnian to sort of sum this up.
Yes. By all means.
Yeah. So while Christoph is queuing it up, I think I will just quickly summarize by saying a huge thank you. Okay, we're all ready.
We need to look at through reimagining education that we can address learning loss and development needs of children. I think we have a once in a lifetime opportunity to reimagine and scale up programming. And we realize now that education is not restricted to classroom walls. It's a big lesson I think we need to take forward, linking home learning to classroom learning, and how do we reinforce each other. But I think the real thing is really to get children back in the habit of coming back to school. Because the challenge now, children have lost that habit, and there's a greater risk of children not returning going forward. We can only build back better by building forward and taking these lessons with us. So have some good come out of this experience over the last year or so.
So building back better by building forward, and we have to reimagine we have to recast the way we restore learning to our children. So schools, as Dr. Kaur was remarking in an earlier conversation, schools are not going to ever be the same again, are they? So we have to sort of be flexible and adapt to the new norm that the pandemic has sort of brought into our lives. And we don't know whether there's another pandemic around the corner. So still voting for that toolbox for that operational algorithm that's going to be user-friendly for all the principal actors, including the media, and still voting for greater conversations between the health department and the education department. Sort of, there's a seamless sort of guidance coming out of both together, acting in unison. And so we hope we get these weather alerts about new variants from both of you. So looking forward to more solutions-oriented journalism. What do you say there? That's sort of constructive, it's going to be provocative and help to think about how we can solve this. So I think with those few words, I'm going to just say a huge thanks to our very, very esteemed and distinguished panelists, so incredibly busy people who've come here and shared their wisdom with us, and the entire Internews team for pulling this together, and all our wonderful participants who've sent us such thought-provoking questions. So thank you very much, and have a good evening and good afternoon and good night.
Thank you,
Thanks for
Dr.
the
Jaya. Thank
opportunity.
you.
Thank you.
Thank you so much. We'll put the recording up as well. It'll be available on the health journalism page. Thank you, everyone.
Thank you so much to the entire team and Unicef for this wonderful, amazing session by you all.
Thank you. Thank you.
Yes, for sure. Unicef colleagues have been very, very instrumental. Thank you so much.